As families are starting to think about expanding their social circle, there are a few basic things to be understood about the risk of COVID-19 infection that can help families make those decisions. And that would include knowing that the risk of infection is associated with the number of people you've come into contact with. It's associated with the physical closeness that you've had with those other individuals, and it's associated with the duration of time that you've spent with those other individuals. So keeping those basic characteristics in mind, families would be relatively safe to start to have discussions, perhaps with another single family, that involve discussions around what those two families' exposures have included in the prior 14 days. And if that list of exposures sounds relatively low risk, then those families may make the decision to make a plan to spend some time together. Another basic rule about spending time together would be that spending time outside is safer than spending time inside when possible, and still having a plan in place before you get together about what that is going to look like. So understanding that being together outside, you should still continue to practice social distancing, and that if that's not going to be feasible, then having an understanding that masks should be available and should be worn. And keeping that kind of communication open with the other family or the other party that you're making those decisions with. When families are thinking about starting to have contact with other family members or friends who may be elderly or have other medical conditions that put them at risk for more severe COVID-19 infection, then clearly extra precautions and extra thought has to go into that decision. So that decision should include careful risk assessment for anybody who's planning on having contact with that individual, thinking about what your own exposures have been in the last 14 days that might make you a risk to that individual. And if those risks all seem very low and the decision is made to spend time with that individual, some basic rules for making that as low risk as possible would be to, again, do visits outside when feasible, to still maintain social distancing even when you're outside. And I think especially in those scenarios with individuals who may be at higher risk, being even more thoughtful about wearing a mask around those individuals, even if you can maintain that social distance. When families are deciding to spend time in each other's houses, some of the same practices that we have all been undertaking for the duration of this pandemic should still be in place. And that should include washing high-touch surfaces, decontaminating those high-touch surfaces, and still, even indoors, doing your best to maintain 6 feet of distance from each other when that's possible.